just gonna wear this mask, obviously because you're sick. I don't wanna get sick. So that's the only reason why we're wearing it. But what we'll do is, for your midterm evaluation, I know you wrote your own information, we'll still go by it's similar. So we'll go by what each of the elements of the competency, what they're asking you to attain. And you can just let me know how you did.
Okay.
So for example, we'll start with planning your shift. So how do you feel like you've done?
I think there's some things that I hit on the head, and there's some things that I didn't move on. In my reflection, I wrote that specifically the thing that I need to work on is not rushing.
Okay.
Actually, if I want to go full compass on what I think I need to improve on, period, is slowing down.
Okay.
Slowing down, double checking, triple checking.
Yes.
For example, my medications, yeah, I catch the stuff, I catch my errors with you. I should do that before you so that there are no errors with you. And it's very easy, it's very avoidable, the things that I've not doing the calculations in front of you, or what was the other thing?
Oh, I think there's one that you missed a med.
I missed a med, or like when my cue cards aren't there, like I'm looking for my cue cards, like things like that, just having everything in order, making sure everything's there, making sure I didn't check, like I didn't miss anything, because an evaluation is gonna count, you know?
Absolutely.
So, and it's so simple, like it's so simple to just take a deep breath and say, let me go back to the beginning.
I totally agree with you. So, what did you write? Like, did you have any specific examples of something that you wanted?
So I sometimes rush through the first med check and don't organize myself well to go to the second med check.
Perfect.
Like I say, okay, check my meds. Let me go get Miss Mary.
Oh, okay,
You know what I
okay.
mean? Instead of saying like, okay, I did my med check. Here's my cue cards. Here's like my medications. Here's everything. Now let me go get Miss Mary. I'm just like, let me go get Miss Mary so I can get it over with.
Gotcha.
You know what I mean?
Yeah.
I also wrote. Time management for tasks. I said like I understand how to prioritize patients. Like with when I had one patient that was more unstable, like obviously I wrote both, but I prioritized him over a more stable patient. And then I said I try and get all of the treatments, like what I need at the beginning of my shift, and then I like see the GM, if I have to calculate in and out, so if I have to do, just so I can have an idea what I need to get done in the shift. And then on my paper I will write it so I don't forget it.
Good.
Sometimes like on the day that I found him, the patient short of breath, it was a little bit like chaotic, and there were moments where I feel like I froze, like fight, flight, or freeze. I froze. More so because I never experienced it. At that point, it's like, what can I do? And that was in my head. But I think I have a better idea now on, let's go talk to somebody. Let's go, like, if the doctor is ordering this, and this, like, blood needs to be done. And he kept on coming back in and saying, the blood's done, you know what I mean?
Right. But it made sense though, right? Afterwards.
It did, yeah.
Because he was making his judgment call were based
on that,
the actual data.
Yeah.
So he was saying, oh, I want to give an S. But when he saw the results, he said, okay, it's low.
That's right.
The x-ray though is showing me another clinical picture. I can't replace it even though I want to. So they need to get all the salient information to make that conscious decision.
And it was hard to plan my shift that day.
Oh yeah.
You know, and then he said, this is what a typical day of an LPN is like. And I'm like, oh no.
I said, welcome.
Yeah.
Welcome to the world of an LPN.
I think it was really needed because sometimes as students it's not the same thing every day, but kind of. You go in, we don't get usually super unstable patients.
I mean, generally,
personally speaking, I've never gotten super unstable patients, and LDs and everything, you know?
Exactly.
Never anything that, like, you come in and it was like, uh-oh.
The thing about it is that a person can deteriorate at any moment. Mm-hmm. So I've seen patients, students that had patients that the day before that everything was working well, but the next day they come in and do their head to toe, and the patient's having a seizure.
Mm-hmm.
So the way that our bodies work, especially because you're on a floor, either internal medicine or this is a short stay unit, they're coming directly from the ER. There's that moment of instability that can occur.
Mm-hmm.
So you encountering that for the first time a few days ago was, I think, for me, I needed you to go through that.
Mm-hmm.
Because if everything had worked perfectly, all your meds were on time, everything was like the status quo, you wouldn't realize what the job actually entails.
100%.
But I saw that you were having difficulty, and I think mostly there's so many things happening at once.
It's very,
What do I do?
Mm-hmm.
You know,
Mm-hmm.
and I think a second time if you were to experience something like that, you would have a little bit more control.
A little bit more, and
Right?
then after that a little bit more.
Exactly.
Yeah.
So you need to. That's why I always say to students, you need to go through hard. You don't want to go through get all easy.
But imagine if I had never gone through anything, and then I get on the floor as an LPN, and I'm kidding.
Okay, so that was great. So I basically had the same thing. For me, I felt like when it came to planning your shift, it's really, especially when you had things that were out of the ordinary.
Mm-hmm.
I saw that you were having difficulty. So it's really that part. It's about prioritization
Mm-hmm.
and really organizing your thoughts, writing things down. So like if you have that priority list, I think I mentioned a couple days ago, you can easily just put a box next to it. For example,
Mm-hmm.
I could put an IV in. You write IV, a box, and then the time when you put it in, you put the check mark and the time. If it's the doctor will give you a list of things to do. You can't remember it all, so just keep track of it with your along with the workday plan.
Mm-hmm.
I think that is going to release some of the pressure and some of the stress of I have to get these things done, and then on top of it, delegate. Because there's some things. When I say delegate, you can't really delegate to the nurse,
Yeah.
but you can just mention to her, and for example, like, are you able to prepare the NS while I put in the IV?
Mm-hmm.
So that at least you're collaborating as a team, and you know that she's taking care of things, because you don't have to stay with her the whole time. So I think that'll be helpful.
Mm-hmm.
But as we go through, you'll get stronger. But apart from that, yeah, the main thing I put was prioritization, and as you mentioned, it's like you're rushing through certain activities. But apart from that, you're doing pretty well. So good for you. So we'll talk about establishing a relationship with the client now.
I find that this is something that comes easy for me. Naturally a people person, naturally like to talk to people, get to know people. Very empathetic, almost to a fault. And that is something I'm very empathetic to a fault. Tears for me, like, I need to learn how to suck them back up sometimes. You know what I mean? It hasn't happened actually on this batch yet that I've cried, but sometimes it happens.
That's true.
And that's something that I need to work on, like disconnecting, like with my own feelings. But no, in terms of establishing a relationship with the client, like being a student is hard to gain the trust from any patient. Even if I had a patient, a student, well actually when I gave birth, I had a student in postpartum.
Really?
Yeah, I'm Jewish. And even though I'm a student, like yeah, there's just something like you're watching them extra closely, you know? So I think for me, like the main way I try to build their trust is just following my word. If I say I'm gonna do something, I'm gonna do it. The guy in 2A that had cellulitis, he was asking me about the escort. I had no idea, remember? I had no idea what it was, but I said I'm gonna find out for you. And even though like I can't help you at all, when I talked to the nurse, I still went back and I said, just to let you know, like I passed on the information.
Good.
Because I'm sure sometimes he hears it a lot. Oh, we'll ask the doctor, we'll talk to the nurse, and then nothing. Like static, you know what I mean?
Right.
Sometimes maybe it'll come back, but as a student, like I just feel like it's something small that you can do to build trust. You know what I mean?
No, I totally agree with you. I think that's a smart thing. And because a lot of the patients too, they're fully conscious. They understand what's happening.
Yes.
And it's true. If you actually following up and following through are key ways to build trust with your patients. So I totally agree.
There was one aspect too about like respecting the client's space. And this was something that before, like at the beginning of the program especially, I had a hard time with because I was so task oriented. So anything that would like disturb the pace of the task, I would be like,
Oh, you get bothered by it.
I would be like, I like now it's just like I don't know, like, I think my mindset has changed a little bit. Now it's like, okay, if you need to, like, if I need to change you, if you need to go to the bathroom and you know, and they have, for example, the lady in 6, she has to go to the bathroom, but it's just like, she goes by herself, she walks assistance on front, but she's slow.
Okay.
Which is fine. But normally, like, if I were in basic care, I'd be like, oh my god, this is taking so long, I need to go chart, I need to go do my medications.
Right.
Now it's like, you're doing well, like, look at you go walk by yourself, you know,
Good.
this man, you know?
Good.
It's just a change in mindset, I think, for me.
I think it's huge.
You know, because at the beginning you're so used to focusing on, like, my teacher's watching me and I need to do this and that, and now I think because I'm towards the end, it's more like patient focused.
Good.
Which helps to establish a relationship with the client instead of rushing her. And I've seen it happen where it's like incision days they rush a lot, you know, the patients.
Yeah.
So I don't know. I think I've just taken all of that from the different stages, and now it's just like let them be. If they're walking, that's a great sign that they're walking. Like independence.
And on top of it, which what you're saying is perfect. And on top of it, if the task is taking a long time, and you know that you have a second or third patient, I think it's also easy for you to say you can assist the person to the point where maybe afterwards the PB can take over, right? You can say the patient maybe wants to walk down the hall of a few I wouldn't say laps, but can you watch her while I go and prepare the medications? So at least then you don't have that much, you don't feel the stress of I have all these things to accomplish and the person's taking a long time. You've devoted a certain amount of time to them, and then you let somebody else take over who has more freedom or has more time on their hands at that moment. And when you finish your task, you can always go back, or while they're walking, you can give that positive commendation, which still shows that you're actually, you care about what they're doing. So,
I think I have a hard time sometimes with delegation. I don't know where it comes from. I don't want to like burden somebody, I think. It's a mindset definitely that has to change.
Right.
But yeah, even like asking like Patricia for help sometimes, I'm like, I don't want to bother her, you know what I mean?
I understand, and I think, like you said, you don't know where it stems from, but were you, for all the stages, was it like that, or were you?
Mostly, yeah. Like, I feel like I should, if I have like only 2 patients, I should be able to handle these 2 patients on my own. Without asking for help.
Okay, you know what do you think is going to happen if you continue with that mindset?
I know.
Because now it's 2, it's going to grow to 4.
I think at one point I will be forced to, like, out of pure like desperation, no choice.
And you don't want to burn yourself out either, right? Because if you think about it, when your patient is working at a certain pace, and then you have that 4th or 5th patient that you have to go and maybe start, administer medications on or do a dressing, you're probably going to start to feel a sense of the internal stress, right? Panic, and then you don't want to try to do everything yourself at the same time because then you can also burn out, right? It's the beginning of your career. So what you can do, you do, but then in order to be able to still breathe, you have to be able to step back and say, I cannot do it all. I'll do X, Y, and Z, but this, somebody else, please can you help me with it? And the same way that you ask them for help and they assisted you, you're gonna give it back, right? When your day is, when you have a day or when your tasks are completed, you won't just sit there and say, I'm gonna go on TikTok and start to watch videos. No, you're gonna extend the hand to another person who's in need. So I think the mindset of I have to do this all by myself is something that kind of puts people in a position where they take too much burden on their shoulders. It's you give like we it's a helping hand.
I agree. I'm
so,
like that even outside of,
there you go.
But I agree. It's too much.
Yes,
at one point it will break my back.
Yes. So at this point, I think we're going to try delegation. So that will be something next week that we're going to implement. Especially since it's something that you feel like you're having a hard time with.
Yeah, for sure.
Perfect. So we'll work on that. But in regards to, so far you're doing satisfactory in both of those categories. Great. Now we'll talk about assisting clients with activities of daily living.
Yeah, well, today, I've had a couple patients where I've had to, like for this lady in 6, I've had to take her to the bathroom, get her changed, even just doing night care, like after medications at night.
Mhm.
The green swab there,
Yes.
the thing for the mouth. Getting them comfortable in bed.
Mhm.
Even the family today asked if I haven't done it yet. Oh no, but she did do it.
Yeah.
She could come out and walk.
Oh, okay.
You know what I mean? And then she came out and they walked with her family.
I'm glad you didn't say I'm gonna do it for myself.
No, I wouldn't have done it by myself. I was so waiting. I wouldn't have done it, but they did it. They went out and they did it by themselves.
Good.
What else did I put here? I put, yeah, she was just sometimes one. There was like a safety thing, like, she has a bed alarm because she
Okay.
can get up on her own if she wanted to. So
Okay.
just making sure that the bed alarm is there, the call bell is in reach so that if she's tempted to get up, she won't get up. Oh, I put that. There was a task I put was that encourages to increase her autonomy. There was one, first night I had her, the other night, I walked in and she was sitting like after break. She had finished her dinner and she was sitting there in the dark, like just in her chair, just sitting there. And I felt so bad. Like it was dark. There was nothing. There was no crossword. There was no book. There was nothing stimulating at all. Yeah, she was just sitting in the dark. So I said to myself, like, I will try and implement things. Maybe like, one time in a social study, I gave a lady, she was like a nona, and I gave her like a washcloth, type of washcloth to fold. So things like this, you know, like when they're moms and stuff or whatever,
Yeah.
like even just like dementia. So these things are like, I don't know, maybe soothing. If not, like I could have like printed out something for her to read or to draw, or you know, like.
I like that.
I just felt bad that she was sitting alone in the garden.
I like that. So maybe you can ask her, so if you get her again next week, ask her what she likes.
That's like, I think that's what I said. I'll ask what her interests are
Good.
and see if I can find something to stimulate her based on that.
I like that. But sometimes it could be just a simple puzzle or like some people like Sudoku.
Mm-hmm.
You can even play, if they like cards, you can get a card game. So when you're done with your day, everything is, you know, you have some downtime, then you can say, okay, I'm going to play a game of Uno or two. And that might bring joy to her because it's like, okay, I'm going to have fun. I have somebody to play with. Because obviously in some of these patients, they would do better in say stressful day. And I think that with her, I mean, she's just coming from an injury.
Yeah.
So from there, I don't know if she'll be able to go home. I don't know what the plan is, but she does need stimulus.
Yeah.
You see her walking around and she's...
Yes.
So I like the fact that you thought of things.
Mm-hmm.
So if next week we'll try to implement them, and we can print them from the computer.
That's right, yeah.
Perfect. So yeah, I agree with you. I feel like this is a category that you are doing well. I'll just make one commentary, and it's mainly to do with like, I think I don't know if it falls under the, it's not planning your shift, so it's really your client. I think in room 2, there's I know that he's going through a lot, so maybe it was being affected, overwhelmed with the situation. But you always gotta remember to organize the environment.
Yeah.
Because I think we left one evening and he rang afterwards. I was still here, and then he said he wanted his linen changed because it hadn't been changed in a few days.
Oh.
Yeah, I said, oh. I'm like, oh my goodness, my student just left. He didn't ring fast enough.
Yeah.
But at the same time, I was like, okay, when we go in the room, maybe these are things that if you see that it's messy, or if you see that he's been in the same type of situation, or the room is not clean enough, let's just do our part and say, is it okay if and then he moved into the chair. I stripped the bed and I helped the PV, and I did it with her, just to make it fast. We cleaned the bed, we set up everything, and I put a blanket around, you know the thing that he had for his legs?
Yeah.
I wrapped the blanket around it.
Oh, so that's not so cold.
Yes, because I'm like, was he laying on this with plastic on his like bare skin? So just little things like that, just to think about, because they do comment, but it's not necessarily when you're there. It can be afterwards, and it doesn't necessarily fall on just you, but because we were the last ones there, that's why I think it's important that we remember those things.
And then I think you had mentioned that to us afterwards, right?
Yeah.
Like, that's when you were talking about it. Maybe the following day, or at some point you were talking about, like, we're gonna start implementing organizing the room.
I think that was the day, but we didn't do it.
Oh, okay. Because I've been a little bit more mindful, but if it was on that day,
Yeah,
it might have slipped.
Yes,
for sure.
There was a day, but I think
Definitely. The last thing I was thinking about was
so maybe on your sheet, just put organization of room. Because if it's something that slips through your mind because you're so busy with other things, you want comfort, which is, and he can't do it himself. So that's why I figured having that little, I won't say little, but having that be somewhere in the back of your mind will be helpful. But apart from that, you're doing really well. So just a little commentary.
No, nice one, thank you.
Okay, we'll talk about providing specific care. How do you feel like you're doing?
Oh, providing specific care. Oh.
She said, oh. Why the oh?
It's an ongoing learning.
Yes.
I cannot.
Yes.
At all.
Yes.
I think I've done more in the 5 days that I've been on this than in the X amount of classes I've done.
Really?
For sure.
Okay.
Hands down.
Okay.
So it's a lot of learning, and I told you already, I took a really big gap in my learning.
Yes.
So the last time I learned the theory was in 2022.
Wow.
To be fair, if I'm honest, I started in 2022, and then I took off in like beginning 2023 until this May that just passed. So I have a big knowledge gap.
Okay.
That I'm still trying to fill in. So when I'm doing procedures with you, like I looked at the videos and stuff that you've sent us, but as for the learning in school, it's been a very long time.
Okay.
That being said, I think the way you explain things are really well, the way you want us to do things, the way you want us to set up the room, like everything you say makes sense. The way you want us to bring the materials, find the vein, do everything before even coming to get you. I love that, to be honest.
You do? Okay.
Yeah, I really do.
Okay, good.
Because it puts less pressure on us while you're there to be like, oh my god,
right?
Find the vein.
That's the whole thing. I figured in my mind, if I'm standing in front of somebody while I'm looking for a vein, that would be nerve-wracking, especially if it's the first or second time. So I want you to breathe. I want you to take the time.
Good. I have to work on the organization of that.
Okay.
Organizing my materials, making sure everything's like open and like, in a way where I can reach it, making sure the environment is like suited for the task. Everything's out of the way, bed is up. Like, I think I just need to like look at the big picture on everything instead of just like I need to find the vein. Okay,
Yes.
but in order to find the vein, like my table has to be clear and the bed has to be high and the arm has to be this. You know what I mean? Like I just like looking at the big picture of things, and like it slips a lot of my mind because sometimes I revert back to the task oriented, like being task oriented. But and it's something I have to keep catching myself in.
No, but it's good that you're reflecting on it though, right? Because it's something that you're realizing this is where an area where I need to put a lot more effort in so that I can make sure that all aspects are being taken care of. So I'm glad that you noticed because I mentioned very similar things in my evaluation of you. So, and it really had to do with that organizational aspect. And it's true, like we want to, it's a skill. I want to be able to get the skill and insert that IV, but
like so much comes before that. And it sets you up for success or not. You know what I mean? And
I totally agree with you. So, and that was, I think for you, the practical aspect of like implementing the nursing skills was the area where I felt you need to work on to improve.
100%.
And I did mention like the organization. I did mention that skill card, reflecting on it, and then setting your patient up before. So we're on the same page. But on a positive note, I feel like you're really strong when it came to your medications.
oh,
Yeah, even though, like you had mentioned before, that you would catch it when I was there. Before you even would say the med to me, you're like, wait a second, hold on, and then you fix it. So yeah, for the next time, I don't want to be present when it happens, but I didn't have to correct you and say, oh, you missed this medication. You caught yourself. So good for you for that. And I think even the way you're analyzing, the making links with your patients, diagnosis and the medications, I feel like you're growing and you're going to look at the patient's labs. You're connecting in a way that shows that you're at the end. Like I don't know what size you're on. I still don't want to know, but I feel like you're very close to being, in a position that you can work alone, but confidently. Because everyone can work alone, but some people are constantly going to the nurse and asking for assistance, I think you're going to be that independent worker that's there to collaborate rather than a dependent.
Yeah,
Help me
goal.
That's
the whole goal.
Yeah. So do we agree this is an area that we need to improve?
100%.
Okay, awesome. So the other three actually, I think you're doing well. It's just this area that I felt like you need to improve. Okay, communication.
I think honestly, I feel confident in this aspect, especially after what the nurse told me the last time. She thought I made a good report.
Yeah.
Like that really because it was something always that I'm like, sorry, fine, then just like give me my report now, and I would give it the way I was taught to give it, the way that makes most sense to me. But there was always that like shy feeling. I don't know. When you're a student, they've heard the report from the other nurse already. They're just listening to you to listen to your report, you know?
The thing is, many of them are actually, it depends. If they're stressed, like when like you saw 3 patients came in not too long ago, like back to back, in that position, they're probably not even hearing you. They're like, okay, just give me the important things. But the end of shift, usually at that point, the nurses, they need, it's continuity of care. So for the most part, they are listening, and you did it in a way, like you mentioned, she complimented you because it was concise, but it's like you're giving salient data for each system. It wasn't like you just said the patient's doing well, I did the vital signs and goodbye. No, like you went through each system and gave her important information that she could note and follow up on. So no, you did really well.
Thank you. Man, that made me feel good. Also, that time when he was, having trouble breathing.
Yeah, it all.
I went right to that nurse and I said, listen. And it's funny because he had nothing since it was the first time, there was no respiratory was not up there for him, right?
Right.
Even when I said, oh, he's having trouble breathing, she was like,
oh, she was surprised.
Yeah, she was like, 2?
Okay.
And I was like, yeah. She said, oh no, he was okay before. I was like, oh, but he's complaining of shortness of breath. So she came with me, and then, well, you see what happened after.
Complete deterioration.
Yeah.
But that's mainly the reason why I mentioned before about that. The patients can change in a moment, right? And in our mind, we're thinking, oh, but they were stable 2 seconds ago. She had him all day until 3:30, and now you come in and it's like, what do you mean he's got shortness of breath? No, he's good, right? But the thing is, you brought it to her attention right away, so good for you. How about your documentation? How do you feel like?
I think it's getting better. There's still some things that I forget to put in, but I feel confident that I can get all the salient data, especially on my priority systems. If they're here for a GI issue, I feel like I can really I make sure that specifically GI, everything is there.
Good.
Or breath or whatever it is, you know what I mean?
Good.
There's always room for improvement.
For sure, but you always want to, and that's the thing, yes, there's room for improvement, but you want to make sure that at least when you're doing your head to toes, by systems, you're able to make sure that you've touched on all these important factors. So for the most part, I honestly felt like your charting is, I had nothing negative to say. Honestly, it was just like a little tweak of, add how much they eat, or but apart from that, you have everything written. So you should pat yourself on the back. I think you're doing really well with documentation. It's actually you're ready. I'm certain when they read your charting, they say this is great. Everything is to the point. You tell us when something happened, what you did, the intervention, and you have the follow-up. You don't write, "will follow up." No, you actually follow up because it makes it super clear for them. So no, I think you're doing very well with that. You use the right terminology, and when it comes to continuity of care, like you mentioned before, the end of shift report, they're giving you already compliments. So what can I say? All I can do is agree, right? So you're doing really well with that. So satisfactory. And then for the maintenance of decorum, no issues, you're always come dressed appropriately. Code of ethics, you're doing well. Demonstrating a sense of responsibility, willingness to cooperate, and capacity for self-criticism. I mean, the fact that you wrote
self-critic,
which is it's huge, right?
Yeah, it's self-reflection. It's not even criticism. It's just reflecting on things and how you can improve.
Yeah, and for me, that's like, as a nurse, every day when I'm doing something, I need to check to see, did I do this well? If I didn't do it well, what can I do so that tomorrow I don't repeat the same mistake? So this one, what you wrote about yourself tells me that you're someone that's open, and head nurses look for that. Like you don't become defensive and try to find an excuse. You say, oh, I did something wrong. Okay, thank you for bringing it to my attention, and then you alter. That's, I mean, for me, I appreciate that. And then obviously the adopting an attitude conducive and appropriate to communication. You have you're someone that's, I can easily come up to you and mention something without, any concern that you're going to take it in the wrong way. So, no, you did really well with that. So all in all, honey, I must say, I feel like you're doing, I should have signed this already, but I feel like you're going to be writing September. It's October.
That's crazy.
October 2nd, 2025. I feel like you've done very well. So congrats to you and all your hard work. So keep reflecting.
Always.
And for the skills for next week, I think you didn't get the chance to do the EKG with them, and I won't keep you today to do it either. But it's something you can look into. And then on Tuesday when we come in, then you can have the opportunity to try it out for you. Well, they'll do it on you, and then you can do it on either a patient, or even I could be your patient if you'd like, and you can put the leads on and see if you can get the reading done properly to gain your confidence.
That would be excellent.
So good job today, and good job. So now at least you're prepared for your second half, getting up to evaluation.
Can you believe it? That's how halfway done. That's crazy.
I know. Thank you so much.
Time passes like